How do you think blood pressure's been trending at home?
Meet Dr. John Daggett, the direct primary care physician. He's taking Sam Leget's blood pressure. It's one of many services included in his monthly subscription fee.
It's a predictable monthly model, and whether patients see me 1 time a month or 8 times a month, that cost is fixed. And so if there's complicated things going on, we're able to really work together.
For $125 a month, Daggett offers what he calls unlimited access. Text, telehealth, calls, emails, and in person inside this small practice in Yarmouth that he opened in January. He describes these last 10 months as an adventure.
Gained about 10 to 12 patients a month. So a slow but very intentional growth pattern. And it's all about making primary care personal.
It's everything that I wanted in that relationship with a primary care physician.
I noticed on the website it says for patients with and without insurance. Do you have patients that don't have insurance?
I do, and I've seen a recent uptick in that. I've had patients reach out and say, I'm planning on dropping insurance with everything going on with healthcare premiums and a lot of uncertainty right now. While this certainly doesn't replace catastrophic insurance coverage and things like that, for folks that don't have insurance, this is, I'd say, utterly important as a means to, never have those patients or any of my patients see the inside of an urgent care unless they really need it.
Are you getting more calls right now of people saying, I'm thinking about dropping my insurance, or I'm just going to go without it, and I think this is the plan that will meet my needs best?
Yes, I am. And I think, I'm clear with patients that this isn't a replacement for insurance.
But Daggett says for the minority of patients looking to make primary care a cash-only expense, he could outsource labs and imaging to partners offering wholesale discounts and get certain medications the same way. In just the last 10 years, direct primary care has grown from 141 practices across the United States to more than 2,700. Today, there are at least 30 direct primary care clinics in Maine, according to the group DPC Nation.
If you look at how much more efficient this model is, it's a no-brainer.
There are concerns, though, that this monthly payment structure could widen gaps between those with and without access to quality, affordable health care. Sharing samples of this story on social media prompted comments such as, "My PCP just left the practice to do this as well, and I can't find anyone to take me on as a new patient." And you pay a fee and still have to pay for insurance? Another wrote, "This is not the answer. We need universal health care." Daggett estimates that roughly 15% of his 125 patients do not have insurance, and says in the last 2 weeks alone, 8 to 10 people have called, sharing their decision to drop coverage. For all patients, though, Daggett says his goal is to make primary care easier to access and more personal.
I understand the hard decision when someone makes that call. It's on me to kind of make their health care make as much sense as possible, even with that limitation.